Today, we're diving into a medical mystery. We're looking at two diabetic emergencies that can happen in the same person, but they look like complete polar opposites. And you know what? Knowing how to tell them apart can literally be a matter of life and death.
So let's set the scene. Imagine a patient gets rushed into the ER. All we know for sure is their blood sugar is through the roof. That's called hyperglycemia. But what does that actually mean? What condition are we really looking at here? That's the puzzle we're going to solve.
All right, to crack this case, we have to put on our detective hats. The first thing we need to do is look at the clues, the physical signs. And trust me, the body is telling a very, very specific story.
We start with what's known as the classic 3 Ps. First up, polyuria. That's just a fancy way of saying excessive urination. The body is literally trying to pee out all that extra sugar. Well, that leads right to the next P, polydipsia, or this intense, unquenchable thirst. Makes sense, right? You're losing all that fluid. And finally, we have polyphagia, extreme hunger. Now this one seems weird, doesn't it? There's tons of sugar in the blood, but the cells themselves are starving.
But the trail of clues doesn't stop there. You'd likely see warm, dry skin and clear signs of dehydration, again, from all that urination. But here's a really big one, the way they're breathing. Deep, rapid breaths. They're called Kussmaul respirations. This isn't just heavy breathing. This is the body in desperation, trying to blow off excess acid that's building up in the blood. This clue is absolutely critical.
So, let's recap the evidence. We've got the 3 Ps, we've got the dehydration, that very specific breathing pattern, and of course, the sky-high blood sugar. With all of that on the table, we can finally put a name to our culprit.
And the diagnosis is diabetic ketoacidosis, or DKA for short. The name itself tells you the entire story. Diabetic is the context, of course. Keto is because the starving cells start burning fat, which creates these byproducts called ketones. And acidosis, well, that's because those ketones make the blood dangerously acidic. See, it's all right there in the name.
So what's really going on under the hood here? Think of it like this. The bloodstream is flooded with fuel, all this sugar, but the body cells are locked up tight and starving. They're missing the key, which is insulin, that's needed to open the cell doors and let all that wonderful fuel inside.
Here's another super important clue, the timeline. DKA is not something that happens in a flash. It's a slow burn. It develops over several hours, sometimes even up to a few days. Now remember that detail. Tuck it away because it's about to become really, really important.
Okay, just when you think the mystery is solved, here comes the twist. Because to really understand DKA, you've got to meet its polar opposite, another diabetic emergency that's basically a mirror image. Let's go back to that timeline I told you to remember. DKA was a slow burn, right? Hours to days. But what if it wasn't? What if this whole emergency came on like a freight train, happening suddenly, over just a few minutes? That one single difference, it changes everything.
A rapid, sudden onset points us to a completely different diagnosis, insulin shock. And what's the cause here? Not high blood sugar, but the exact opposite. We're talking about severe hypoglycemia, meaning critically low blood sugar.
So if we go back to our analogy, if DKA is a body with a full tank of gas but no key to start the engine, insulin shock is a body that has simply run out of gas. There's not enough fuel to keep things running, especially the brain, which is why the symptoms hit so hard and so fast.
All right, time for the main event. Let's put these two conditions side by side for a final showdown. This is where the differences are going to become crystal clear.
At its core, it boils down to this fundamental conflict. With DKA, the whole crisis is about too much sugar in the blood. With insulin shock, it's a crisis of too little. It's a simple distinction, but an absolutely vital one.
This table just lays it all out perfectly. You've got DKA on one side, high blood sugar, a slow onset, and those classic signs of dehydration like thirst and warm, dry skin. And on the other side, you have insulin shock, low blood sugar, a super fast onset, and signs of a body in crisis. Think confusion, sweating, and pale, cool skin. The contrast couldn't be more stark. So when it really comes down to it, while all the signs matter, that speed of onset is often the most critical clue you have. One is a slow, gradual build, the other is a sudden, terrifying crash. Getting that one piece of information right is the first, most important step. Understanding this difference can absolutely save a life. But it really makes you wonder, doesn't it? What other medical conditions out there exist as these kinds of polar opposites, where telling them apart in a crisis is everything. Definitely something to think about.